all, let me say thank you so much for taking the time to come out here. I know at Pacific Research we're very grateful for all the people that come into our clinics and volunteer their time. So I think that this is the same exact thing. The fact that you're volunteering your time to come and hear what we have to say is greatly appreciated. My name is Misty Daniel. I am a clinical research coordinator. Not that that means a lot to you as far as titles go, but what it does mean is that I have the pleasure of meeting the people that come in and day out to have their memory tested. I have the pleasure of doing that. I come and meet people, and I see some familiar faces this evening. But more importantly, I've been at Pacific Research for 8 years, and I'm probably one of the few that have been there the least amount of time. We are in two areas, one in San Diego and also in Rancho Bernardo. We are the largest memory clinic in Southern California, but despite our size, more importantly, we have been a part of all 5 FDA-approved drugs right now for Alzheimer's disease. You may not realize that there are 5 FDA-approved, but number 1 prescribed typically is a drug called Aricept, also known as donepezil. So we have not only been involved in the past, but we are continuing to be involved in the future as well, which was what makes this evening so important. So, without further ado, I know you didn't come to see me speak up here. Just to kind of give you an idea, we have 2 featured speakers this evening. One is Dr. Richard Isaacson, and the other one is Dr. Jill Crusey. Dr. Isaacson, who has flown in this evening just to come and speak with you all, we're very grateful for that. He is actually going to be discussing recent advances in the dietary management of Alzheimer's disease, including the innovative approach of ketosis therapy. Those are big words, so I let him explain all that fun stuff to you guys. Dr. Isaacson currently serves as the Director of Alzheimer's Disease Prevention Clinic and the Director of the Neurology Residency Training Program at Weill Cornell Medical College in New York Presbyterian Hospital. He is the author of the 2 best-selling books, which we were able to have here this evening, geared for patients and caregivers of Alzheimer's disease. Dr. Isaacson has appeared widely in the media, including CNN.com, NBC, CBS, ABC, The Wall Street Journal, USA Today, and U.S. News. But more importantly, he has luckily been here and graciously agreed to be here this evening to speak to you all. He will be staying afterwards to answer some questions and to sign the books that you've taken this evening. I'm hoping that you will seize this opportunity to have a one-on-one conversation, ask any questions you may have of him, but more importantly, just to get a better idea of anything that you may have read if you have already read the books already. And then after the fact, in between, by the way, feel free to get up if you want some more coffee, some more water, use the restroom. Don't feel that you have to wait for the break. But we will have some breaks in between and an opportunity for you all to ask questions. So without further ado, I'd like to introduce our first speaker, Dr. Richard Isaacson.
Good evening, everybody. How are you? It's like midnight on East Coast time. I'm like, if I keel over and fall asleep, I apologize. Thanks so much for coming. Can you guys hear me okay? Okay, great. I hope my jokes perform as well on the West Coast as they do on the East Coast. In New York, we got jokes about bagels and pizza. I don't know, what do I do here? Palm trees, tacos, what do you think? I don't know, I better change it up a little bit. So my name is Richard Isaacson. I am on the faculty at Weill Cornell in New York City, and New York Presbyterian Hospital, one of the largest hospitals, I believe, actually in the country. I'm an Alzheimer's specialist. I'm a brain doctor. I can't ride a bike, and I'm really bad at swimming, but brain surgery is easy, that sort of thing. And today we're going to be talking about a subject that I'm sure all of you have either been touched by or know someone who's experiencing it, maybe experiencing memory loss yourself. And we're going to try to give you kind of a broad brush overview of a topic you may not have heard about within Alzheimer's, and that's nutritional management. There's a saying, and actually I think the saying is somewhere in the book. It's one of the quotes we chose for the book, and it's, "You are what you eat." You've heard of that, right? You are what you eat when it comes to brain health too. We didn't realize that. So we're going to talk today about not just about eating healthy food, but it's much more deeper than that. And we have a nutritionist outside. I think she's in here now. Where'd she go? Oh, there we go. Hey, how you doing? So, if, in our clinic, we send people to nutritionists to really spend time with people, to teach people how to eat. I'm going to try to give you some tools tonight, some kind of bullet points, okay? And then I'm going to also refer you to a website, a free course that you can take online to learn a little bit about nutrition, okay? So you can leave here and know that, yes, you have a book and you can read the book, but you can go onto your computer, your iPad, your cell phone, any device, and you can take a little mini course, not only about Alzheimer's disease, but also about Alzheimer's nutrition. So at least you'll leave here with resources and tools. And if you have any questions, no hard questions. Remember, it's midnight my time. I'm keeling over here. Any hard questions? Please ask the very well-dressed guy in the suit over here in the front. Okay, so let's get started. First of all, in terms of disclosures, I've been very gracious. I've received grant support from the American Academy of Neurology, Alzheimer's Association, National Institutes of Health. They actually pay my student loans, so I'm very gracious for that. I've received support from different philanthropic organizations and people, patients in the clinic. I've done some consulting for a company called Xera. But if you see on the bottom here, Uncle Bob and my dad's cousin Charlotte. So what is my biggest disclosure? Why do I take the approach that I take when it comes to Alzheimer's disease? And that's because I have a family history of Alzheimer's disease. And if you look on this picture, this is Flatbush, Brooklyn in 1946. I have 4 family members in this picture that were diagnosed with Alzheimer's disease. So I was literally this big. I was 3 years old, and actually I remember my great uncle Max kind of being the older guy, staring out the window, not really talking. I just thought he was kind of quiet and just kind of Uncle Max, and we didn't really know what was going on. And then later on, people said he was senile or he had senility or something, and then his behavior changed, right? And then I was in high school, and I see my Uncle Bob, sweetest guy, like the sweetest guy in the world. He introduced my parents, actually. You can actually read a little story that I wrote in the book, I think in one of the introductions about my Uncle Bob. But my Uncle Bob was like the sweetest, most amazing guy, and then all of a sudden he started forgetting things. And again, it's just normal aging. That's normal, right? Well, it wasn't normal. It ended up being Alzheimer's disease. And then actually I finished all my training. I trained all over the place, from the Midwest to Miami to Boston to all over. And I finished my training, and I'm going to get out there and I'm going to fight Alzheimer's disease. And I'm sitting next to my dad's cousin at a wedding. She tells me the same story 5 times in like 15 minutes. And I said, you know what? I think I see what's happening. And everyone's like, no, that's just normal. That just happens as we age. So today I want to kind of give you a broad brush overview of how Alzheimer's develops and how, no matter what age you are, we can all make brain healthier choices. And I also want to teach you about some of the new innovative nutritional mechanisms. Okay, one of the words that was used earlier was ketosis therapy. Ketosis is a big word. The easiest thing that you can remember, any hard or difficult word that I say today, just replace it with an easy word that you've heard about. It's the word battery. You all know what batteries are, right? Okay, the cells in the brain use energy. I want you to think about the battery, okay? Because we're going to try to give the brain another fuel source, a cleaner burning fuel, and I'm going to teach you about energy mechanisms in the brain. Sound good? Using nutrition. So that's the take-home points. There we go. So I want to take you on a little bit of a deeper dive here. So believe it or not, Alzheimer's disease starts in the brain over 20 years before the first symptom of memory loss. So I want to teach you about this because it's because we know the earlier you intervene, the better a person will do. If you look at this slide, this is my Uncle Bob, and he's 31 years old. He has no symptoms, no problems, no bad stuff going on in the brain. He's at stage 0 because Alzheimer's has not yet started. However, at stage 1, he has normal memory, but the disease has started in his brain. This is my Uncle Bob. He's 45 years old. Normal memory, but his brain isn't functioning. The energy in his brain is not functioning right. So as Bob gets older, well, Bob now is in his 60s, and he's just senior moments, he's forgetting things, normal stuff. But actually, he's got stage 2, mild cognitive impairment due to Alzheimer's, and then this is called dementia, where he can't take care of himself anymore, and he's 72, not doing well. His brain is shrunken. You can see an Alzheimer's brain versus a normal brain, and this is Alzheimer's disease dementia. Does that make sense? So the goal of this talk tonight is to give you an overview about Alzheimer's, and then an overview about the interventions. We've heard about the drugs that are available, and there's several FDA-approved drugs, prescription drugs. Take one in one class, and then there's one other medicine in another class. So usually most people with Alzheimer's disease end up taking 2 drugs, but it's not all about the drugs. Drugs are important, and clinical research studies are like absolutely essential, not just to try to put people on new innovative therapies as early as possible, but also to help prove that these things may work so that thousands and tens of thousands of people can get them. So it's not just helping yourself, it's also helping others too. So let's go through a little overview. Alzheimer's statistics, you guys are going to be familiar with this. Most common form of dementia. I get a lot of questions, well, what is Alzheimer's and what is dementia? Well, dementia is all types of problems that affect memory. But there's different types of dementia, and Alzheimer's is the most common, okay? If you look at the statistics, at the age of 71, 1 in 7 have dementia. 1 in 7, 71, that's easy to remember. But if you're at the age of 85, up to 45% of people have Alzheimer's. That's a terribly high number. People say, it's too high. That's crazy. Well, actually, that's what the statistics pan out. Anywhere between 42 and 46% of people over the age of 85 have Alzheimer's disease. That's a lot. Now, once you hit 91, you hit about 50%, and then it's all downhill from there. So make it to 91, get past 91, and your likelihood of Alzheimer's actually comes down a little bit. So smooth sailing, right? Smooth sailing, nice and easy. Okay, I think I broke the microphone. Excellent. Okay. Oh, yep, I broke the microphone. Let's see, I should be able to fix this. No, not rocket science, not brain surgery. Yep. Okay, there we go. I waved my magic hand. Okay, fine, he fixed it. He walks up and then the microphone magically stays. Anyway, that was good. That was crafty. No hands. You just waved your hands. And anyway, how are the jokes going so far? East Coast, West Coast. Okay. Okay. Anyway, so statistics. If at the age of 85, 45% of people have Alzheimer's, well, what did we just learn? That means that the disease first started in their brain between the ages of 55 and 65. So if you're sitting in this room and you're between the ages of 55 and 65, now is the time to make brain healthy choices before the Alzheimer's starts. Meaning memory loss, because the Alzheimer's starts in the brain decades before. Does that make sense? If those senior moments have started already, that's okay. Alzheimer's is nothing to be ashamed about or afraid about. It's a terrible disease, don't get me wrong. Believe me, I've seen it. But don't let fear paralyze you into taking action. Okay? Get educated, get informed, come to things like this. If you have a friend that's having memory glitches, tell them to come on and get a memory screening. It's super easy. It takes like 5 or 10 minutes, and the earlier the better, okay? Let's give you another statistic. If at the age of 65, 10% have Alzheimer's, a lower number, but it happens, that means the disease in their brain first started between the ages of 35 and 45. Okay? So that's how Alzheimer's disease has changed over the last 5 to 10 years or so. Our thinking about Alzheimer's has changed. So if you have kids and grandkids, especially also, it's never too early to start. When it comes to Alzheimer's prevention for 30-somethings with no symptoms, if they said it in the Wall Street Journal, it must be true, right? Right? It's kind of like the government. Whatever the government tells you something, it's got to be true. No, maybe not. So Alzheimer's, so it hit the Wall Street Journal. We started an Alzheimer's prevention clinic in New York, and after this, I could write scientific papers and publish articles in journals, and I can do research that takes years and years to publish. It hits the Wall Street Journal, and I have a 9-month waiting list. That's how this happens. So the earlier the better, okay? It's now Alzheimer's prevention. Alzheimer's and prevention, I want to talk about this briefly, and then we'll of course switch to treatment, but Alzheimer's and prevention can be talked about in the same sentence. There's no one magic pill or one magic bullet or one magic anything that can prevent Alzheimer's. I'm not saying that. But Alzheimer's prevention means, can you reduce your risk? Can you prevent a heart attack? Okay, we say yes. Can you prevent a stroke? We say yes, but can you prevent Alzheimer's? And we kind of say no, and some people say maybe, and most people say probably not, but 1 out of every 3 cases of Alzheimer's disease can be prevented, okay? The problem here is that 2 out of 3 cannot. Certain people can do everything right. They can eat the perfect diet. They can do exercise, they can be perfect, but because of genes or because of other things, they're going to get Alzheimer's anyway. So that's the complicated part. There's no one size fits all when it comes to Alzheimer's disease. But when you start seeing the U.S. News, Best Hospitals editions and other reputable medical journals talking about this, and on the cover here we have preventing Alzheimer's, that means that we can start having conversations. So we'll talk a little bit about prevention, and then we're going to transition to overall management and treatment. This is a patient of mine, another patient, very courageous. Her dad was diagnosed at 58, 59, and just passed away actually at 66, unfortunately, from Alzheimer's, and she was very courageous and told her story in the journal and in the magazine, and it's trying to spread the word that we can do something about this. So first, what is an Alzheimer's prevention clinic and how do we do things? And the first number one rule of thumb is we have to keep things that are evidence-based and safe. We have to do things based on science and that are balanced and safety. There's also, like I said, no one-size-fits-all approach. And it's not a recipe, it's not an algorithm. So I can't just, someone says to me, well, Dr. Isaacson, how do you prevent Alzheimer's? I don't know, I don't need to know you, because Mr. Smith may need A, B, and C, but Mrs. Jones may need therapies X, Y, and Z. The problem with Alzheimer's prevention, Alzheimer's treatment, Alzheimer's in general, it's a very heterogeneous disease, meaning it's all a mishmash of things. So one person may respond to one thing and another person may respond to others. Does that make sense? You've heard of personalized medicine? Okay, meaning we're going to check your genes, we're going to give you therapies tailored for your genes. Personalized medicine, when it comes to Alzheimer's, is now in its infancy, but at least we're starting to understand it. Make sense? And even when it comes to ketosis therapy, I said ketosis, take the word, throw it in the garbage. What word we're going to replace it with? Battery, good job. So when we're talking about battery therapy for the brain, giving the brain extra energy, when we talk about the battery of the brain, certain people with certain genes, that battery works. Other people, it doesn't work. Or we don't think it works, but we need more information. And that's why in one of the research studies that you're going to be hearing about tonight, they're going to actually do a test, and depending on a person's genes, you'll either qualify or you won't qualify for that specific study. If you don't qualify, it's okay. There's other studies. If you do qualify, that's great. So that's the era of personalized nutrition, personalized medicine, and that's really where all of medicine is, I think, going. So what do we do? And whether we look at a patient with Alzheimer's disease or when we're in the Alzheimer's prevention clinic, I believe that it's not just about giving just a prescription drug. Drugs are super important, and they're a part of the puzzle. But just like when you're making a stew, you know, a little bit of this and a little bit of that, and the vegetables and the bouillon and the whatever else. In New York, we don't cook. We have like takeout everywhere. I use my microwave frequently, or just, I don't know, get delivery a lot. That's what we do in New York. Managing a patient with Alzheimer's is the exact same. Okay, it's a little bit of this and a little bit of that. There's no one magic thing, but if you do multiple things at once, that's when we have the highest chance for success. Does that make sense? Okay, so what we try to do is we look at a person's risk factors, genetics, and biomarkers. What's a biomarker? That's something that you can look at in the blood or genetics or all sorts of things. And we try to take this nice fancy sports car and we try to look under the hood. And we try to look under the hood and we look at the gauges and we try to figure out, well, what's going on in this sports car or what's going on in the person's body. Depending on what we see in the tests, we can then follow the person's metabolism, lipids, that's cholesterol, inflammation, nutrition. These are all the things we follow over time. Make sense? We follow those markers, and we also follow cognitive function, so memory or thinking skills. Every 6 months, this is the stuff that we look at. Now, just because this is the way medicine is, this is hot off the press. A lot of people would say cutting edge stuff, and it is cutting edge stuff. I literally learned something that I'm reading in an article and I apply it the next day in my clinic. The problem here is that in medicine it takes 15 years for something to be proven in science for that proof to be permeated into medical practice. It's just the way medicine is. It just takes time. People learn things in med school and then they do training and then they don't learn as much going forward, and it's really hard being a doctor. You have to see all these patients, the reimbursements are low, it's really difficult. I have an hour and a half with every new patient and an hour for every follow-up patient. When you have this type of time, because I'm subsidized by research funds, most doctors wouldn't be able to do this. If I was in private practice, couldn't pay my loans, I'd be, I'd be bankrupt. I'd be living in my office probably. But what we can do is take this kind of deep dive approach. Yep, question?
Medicare will pay you to talk about end of life with someone, but they won't tell you how to save life.
That's a really good point. So the question is about Medicare. Medicare will pay for certain things. Medicare, actually, I'm going to just say all of medicine, we get paid, doctors get paid to treat a disease. We don't get paid for prevention. I counsel patients for a ginormous amount of my time. Because I talk to patients, I get less money because of that. Okay, the way I code, I'm an honest coder. I code honestly. I say 50% or more of my time was spent with this person counseling. I get less money. That's just the way it works. Okay, but hopefully Medicare, and actually the whole system is actually changing. Believe it or not, it's called the pay-for-performance system, where doctors will get reimbursed for the quality of their care. So in the next 5 to 7 years, things will be changing a little bit. So what do we look at? We look at things that you can change and things that you can't change. So if you can't change it, it's called a non-modifiable risk factor. You can't change age unless you live in Florida. If you found the fountain of youth, Ponce de Leon. I haven't found that yet. Botox does not count. Okay, that's all over Florida, not too much in New York. Modifiable risk factors are things you can change. Dietary patterns, physical exercise, cognitive engagement, musical activities. I joined a rock band. You guys think I'm kidding. That's how I knew how to do this thing, but he beat me to it with no hands. And also cardiovascular risk. So if you have something like high blood pressure, high cholesterol, diabetes, if you have diabetes, you have twice the likelihood of developing Alzheimer's disease. Okay? If you have high blood pressure, high cholesterol, and it's not getting treated, you're going to advance much more quickly with your memory loss rather than someone that is having aggressive treatment. You know, we're even realizing that certain diabetes drugs may actually slow down progression of Alzheimer's disease, hot off the press stuff, and they're doing research on this stuff now. So let me give you a quick patient example. His mom, who I also see is 58, this is a young guy. This is one of the younger guys in my clinic. He's 32 years old. And basically what we do to modify risk, to reduce risk, we can change dietary patterns, we can talk about physical exercise, we can look at engagement strategies like music. Music is one of the best things that a person can do to stimulate backup pathways and create backup pathways in the brain, and monitoring cognitive risk. When it comes to treating someone with Alzheimer's, you guys I'm sure know that music is one of the most powerful things that a person can do to try to stimulate the memory and stimulate the brain of a person with Alzheimer's. Listening to music, dancing, singing, the words will come right back. It's an amazing, powerful thing. So again, this illustrates the multimodal, comprehensive approach. And you know, we look at things like cholesterol because we're trying to have the son not turn out like the mom. And that's why we're intervening. You can see the son is 25 years younger, and we want to prevent the greens from going to the reds over time. And we follow these patients over the long haul. We look at different markers in the blood. This is a marker called homocysteine. It's an amino acid. We now know that if you're age 55 and above, and you have this marker in your blood, and you take B-complex vitamins, very specific B-complex vitamins, you can slow memory loss, and you can slow shrinkage of the memory center in the brain. Okay? This is something that's been proven. It's in the UK, in England, people do this. But in the United States, people don't do it. Because B vitamins, as an example, actually this was a study that was kind of pioneered right out of San Diego. When they used B vitamins for Alzheimer's patients, the B vitamins didn't work. Well, why didn't they work? Unfortunately, it was a little bit too late in the course. The earlier you can use the B vitamins, the better. There's other studies that show one B vitamin called folic acid. If you add that to a FDA-approved drug called donepezil, or Aricept, you've heard of it, or Exelon, rivastigmine, which one you want to use. There was one small study that showed add folic acid plus the FDA-approved drug, and that drug works better. So the key here is it's not this magical eeny, meeny, miny, mo. We try to base our recommendations based on the best science we have and minimizing risk. Does that make sense? This person has a gene, so a specific Alzheimer's gene, so we may have to be more aggressive in someone like him. And he has another gene here where we may have to make other modifications. So again, certain patients I can throw the kitchen sink at, and nothing's going to work, or minimal is going to work, or it's only going to help a little bit. Other patients, I throw the kitchen sink, they exercise 3-4 hours a week, they take the meds, they take the vitamins, they change their diet, and things stabilize for a little while. They can even improve a little bit, and then of course, after a few years, things are always going to continue to go down, but at least we bought some time. And in one study that we'll be talking about later, if you don't have this gene, then you're eligible for the study. If you do have that gene, then you're not eligible for that study, but you're eligible for other studies. Does that make sense? Okay. This is the research that we do because we're trying to learn more. So the patients that we see in our practice go into a registry, and we follow their progress over time. And this is really one of the first of its kind studies on dietary interventions, and that's pioneered at Weill Cornell and New York Presbyterian. And really, really exciting study that hopefully in a few years from now we're going to be talking up here about the results of this study. So we can really know what dietary choices work best in different people. Okay, the dietary advice I'm going to talk about today probably is more of a one-size-fits-all approach. Nutrition and Alzheimer's, there's been an exponential increase in the evidence. So if you haven't talked about it too much, well, because if you see the research studies back in 2000, there were 3 research studies that were published in the year 2000 on nutrition and Alzheimer's. Now there are over 100 last year. That's pretty good. And now it's probably going to be over 200 in the next couple of years. So each year they're really increasing exponentially. Because we're trying to figure out what this brain healthy diet is versus a heart healthy diet versus an overall healthy diet. Okay, we know that we can eat heart healthy, we kind of understand that. Well, how does one eat brain healthy? And it's not just about eating. Eating is a dietary pattern. So you can have the Mediterranean style diet, you can reduce your calories. That's a dietary pattern. Nutrition implies not just eating a certain way, but also single or multi-nutrients. So we talked about the B vitamins, vitamin D, caffeine, medium chain triglycerides. We'll talk about those. Omega-3 fatty acids, that's in fish, things like that. So there's dietary patterns, the way a person eats, and then there's single and multiple nutrients that are part of any brain healthy diet. Does that make sense? So it's not just, eat some blueberries or eat a Mediterranean style diet. Mediterranean is about the best you can do, we think, but it's much more complicated than that. It's not just, have some olive oil and eat lots of plants. That's about the best thing you can do, but there's much more to it than that. So let's talk about the Mediterranean style diet. Plant-derived foods, so fresh fruit, as your plant-derived fruit, fresh fruit and especially vegetables will be as your primary source of carbohydrates. Olive oil is your primary source of fat, and fish and lean poultry is your primary source of protein. You focus on these 3 things and cut down those carbs white breads, white pastas, minimize the sugar as best as possible, baked goods. Those are the best types of brain healthy dietary choices you can make. Reducing red meat, low-fat yogurt once a day I think is a good idea, and wine in low to moderate amounts. Yes, I said wine is okay. As long as your doctor says okay, women 1 glass a day, men 1 to 2. And we don't even know if it has to be wine, 1 shot of scotch, 1 this, 1 that. We don't exactly know which alcohol is best. I made a lot of happy, smiley people in the back corner of the room over there. One part of the Mediterranean style diet is style means physical exercise. In the Mediterranean regions, people are also active, okay? So 1 + 1, nutrition plus exercise, 1 + 1 equals not 2, but 3. Because this invokes the biological principle of synergy where you have 2 things together and you have more of an exponential benefit. Make sense? So you can't just take a magic pill and prevent or cure Alzheimer's, no way. But if you do a little bit of this, a little bit of that, a little bit of that, and really overhaul your entire life, that's the best chance we got. Still isn't going to be perfect for everybody. In terms of dietary patterns, this is a study where they put half the people on the typical diet in the United States, okay, the typical Western-style diet, versus a more brain-healthy diet, a little bit lower in fat, lower saturated fat, the good carbohydrates instead of the bad carbohydrates, and lean proteins, the good brain-healthy proteins. What they showed was the people that had the good diet improved their memory in just 8 weeks. It's not like a lifetime. Yes, if you do it for a lifetime, you reduce your risk. That's when you're younger. But when you're older, you can change your eating and actually improve your memory. Okay? People don't realize this stuff, and it's very safe. This is a study where, there's that word, ketosis. Ketosis means battery, good job. Now you can drink the energy, you can drink the batteries. That's weird. Don't drink batteries. You can drink the ketones, that's one way to do it, or you can make your body produce ketones. The problem is, if you want to make your body reduce ketones, you have to almost completely stop eating carbohydrates, meaning less than 30 or 40 grams of carbohydrates a day. That's 1 can of Coke and no more carbs. Pretty hard. It's so hard that most people don't recommend it because it's almost impossible for most people to follow. But in a research study, and this is only able to be done under the close supervision of a certified dietitian, okay, or a physician, or both. Otherwise, I would not attempt any very, very low-carb diets. May not be the safest. But when you generate ketone bodies, ketones, battery, when you generate the natural battery, by reducing carbs, you can improve memory, lose weight, reduce waist circumference, reduce your blood sugar, and reduce your insulin levels. So you really are. You are what you eat when it comes to brain health, and also helps your body health too. So there's another innovative way to use ketosis batteries. So you have a car. You have a lot of hybrid cars here in California, huh? Okay. So the hybrid car, you have the gasoline, and then you have the battery, right? Which is better? The battery, the cleaner burning fuel. So the gasoline of the brain is sugar. The brain can only use 2 different types of fuel. Sugar, which is like the gasoline, or ketones, which is like the battery. It's a cleaner burning fuel. So in order to generate ketones, you could either completely stop eating carbs, good luck with that, and I do not recommend that, and you got to talk to your doctor and all that kind of stuff. Or you can actually maybe drink ketones, administer ketones, and that's one of the newest studies that you guys can participate in, or people that you know. So, what is it? It's a mixture. It's a mixture, and it's like a beverage. You can actually drink ketones. Yeah, instead of taking a pill, you actually drink it.
So where do you get it?
It's a clinical research study. If it were only that simple. So this is the brain, and the brain, see the different colors? This whole brain should be all red, but you see these little green parts? That means the brain is not having enough energy, okay? So you have the battery, you have the brain cell, and the battery of the brain cell is called the mitochondria. You don't have to remember that word. But if you can drink this drink, you basically give more energy to the mitochondria. You give more energy to the mitochondria, and this gets into the technical stuff, so this is probably too much jargon, but if you can address the mitochondria and the glucose issues and the oxidative stress, you can minimize, we think, we hope, and I'm pretty sure, we can minimize the bad stuff happening on the route to Alzheimer's disease. Does that make sense? So that's where the science is going. So can we use this alternative fuel source for the brain? It's pretty safe. That's what one of the first trials showed, and now we have to prove that it works, okay? And in one study, the first study, this is kind of the precursor study. If you look at this is the separation of, people that got this stuff, the real stuff, improved. People that got the placebo, because people have to get placebo, initially declined. And what this shows is that we were able to use a battery by drinking a ketone to improve cognitive function. Does that make sense? Okay. There's other ways to try to improve brain metabolism, and that's to reduce your calories. Eating less than 2,100 calories a day was associated with half the risk of developing Alzheimer's. Less is more when it comes to calories. If you've ever counted calories, you'll be amazed at how much we eat in the United States. If you ever counted carbohydrate grams, you'll be amazed at how much you eat. I think I'm pretty good with carbs, and the one day I decided to track them, I was almost double of what the USDA says to eat in terms of carbohydrates. So less is more sometimes. Deep breath. It's going to be okay, guys. You have your wine. You have your wine. It's okay. It's okay. There's been different dietary studies out there. One of the studies, called the DASH diet, tried to stop hypertension. Well, guess what? Blood pressure improved, but guess what also improved? Memory function. And they said, wait a minute, memory's improving. They better be onto something. And then they did another study where if you follow this really brain-healthy diet, a lot of this stuff is in the book too, you reduce your risk of Alzheimer's by 53%. Wow. Okay, so let's say, well, what about older adults with some maybe very mild memory trouble and some already at a higher dementia risk? If you not only use nutrition, but you also exercise on a regular basis, that means 2 to 3 times a week of cardio and at least twice a week of weight training. This is the big clincher here. You can't just go out and run a marathon. If you want to run the marathon, New York City Marathon this Sunday, get excited. You can run to New York, run the marathon, come on back. Don't just run a marathon. You have to build up muscle. As we age, we gain fat around our organs. It slows down our metabolism, and we lose muscle. The way to stay healthy is to not just cardio exercise, you have to maintain muscle mass and reduce body fat. These are things that we have to watch carefully. So when you did all of these things together, okay, significant improvements in cognitive function. Okay, it's pretty good stuff. This is after a 2-year study. These results were the updated results were just published on Saturday. I was in Switzerland and the author was speaking. So I just got these results, hot off the press stuff. You may have heard about fish oil. Fish oil is a kind of a catch-all term. What you really should think about is omega-3 fatty acids. Omega-3s. The fish eat the algae. The algae have the omega-3s, and then we call it fish oil. Okay? The problem with fish oil is taking it may not be the right or wrong thing for you. It's all individual, so you have to talk to your doctor about that. And different people may need it, and different people may not benefit, so it's really confusing. We talked about the B vitamins, that if you only if you have this high amino acid in the blood and you already have mild memory loss, you take these B vitamins, you can slow brain shrinkage and improve memory. Okay, again, a study that's been published, huge study, thousands of people just don't know about it. And don't take B vitamins unless your doctor says okay, but it's something to talk to your doctor about. Wake up and smell the coffee, that means there's only 5 minutes left. How am I doing, by the way, on time? 5 minutes? Okay, cool, great. Now I can talk slower and give some more jokes. Okay, so wake up and smell the coffee. That means that coffee is okay for the brain. Okay, 2 to 3 cups earlier in the day, no caffeinated beverages after 1 or 2 o'clock in the afternoon. It will completely mess up your sleep-wake cycles. Yep, I heard that. No, and alcohol at night, that's bad. Screws up your sleep-wake cycles. Caffeine at night, really bad. Even if alcohol gets you to sleep, it doesn't mean you're having good restful sleep. These are really important points. So coffee is okay earlier in the day. Flavonoids, I think there's a spelling error there, sorry about that. Antioxidants, and you can get antioxidants in berries and antioxidants in dark cocoa powder. Okay, now you can't just go out and eat a dark chocolate bar and think your brain's gonna like completely be perfect, because if you look at the nutrition label and if you look at the ingredients, how often do you guys look at ingredients? Okay, good. Well, we have a crowd with a vested interest. I don't eat anything unless I look at the ingredients. I saw a video once on TV, or I was watching TV actually, and they showed how they make chicken nuggets. I've never eaten a chicken nugget since I watched this video. Google kids watching chicken nuggets, and you see the people, and they take the white meat chicken off the chicken, and it's like this nice thing, white meat chicken, right? And then they take like all the rest of the chicken and throw it in a blender, and then put white flour and dye, and blend it on up, and then make it into nice little patties. And the kids, they see the little chicken nuggets, and they see the white meat chicken, they still eat the chicken nuggets. I've never eaten. I literally have not had a chicken nugget in more than like 2 or 3 years since watching that. Anyway, now that I've completely grossed out everyone, I apologize. It's great. People leave my lectures and they like stop eating. It's like, it's good. I lost 5 pounds after seeing you speak. I should work for like Jenny Craig or Weight Watchers. I miss my calling. Anyway, so these are the good stuff to eat. So if you look at the dark chocolate in a bar, it says sugar and butter, and then more sugar and butter, and then some dark cocoa. Okay, but if you have the purified dark cocoa, actually you can read about this in the book, people that had heart attacks with regular intake of a very specific type of dark cocoa powder improve memory function, improve their blood pressure, and improve insulin resistance, which is tied to diabetes. Interesting, right? When it comes to flavonoids, this is the strong stuff in berries, blueberries and strawberries. People that had a half a cup at least 2 to 3 times a week, slowed their cognitive decline by 2 years. Okay, so you can't eat one blueberry and think you're going to prevent Alzheimer's. No, but minimum 2 to 3 times a week, a half a cup. That's a lot. It's a fair amount, especially when it's out of season. These are different things that you can do. And you do all of these things together. That's the key. This is a very long list. Now, you don't have to read this because this is still under development, but this is our diploma diet. This is a checklist that we give to our patients to try to figure out what they're eating, and this is how we do our research. So you don't have to look at this as just an example, but this is how we track patients. And this is how we track patients online. So we give patients a piece of paper, and then we've built an online system. And since we built it and our patients use it, we said, why don't we just make it available to the public? So we did. So this is going to be all available for free online. You can use it yourself, and you'll see the website in just a little bit. And the website you're going to get it's completely free. It's built by Cornell and New York Presbyterian. It's a free online course. It's actually a research study, so you actually can join the course. You take the course, you can learn, do pre and post test questions and stuff like that, and you can learn about all this stuff. And actually, the study that you're going to learn about today, a little bit more in detail, more information about that study is also on that website too. So if it's related to nutrition and Alzheimer's, it's on that website. So this is a nutrition tracking system. It's all, again, for free. You can track your carbohydrates. And just like when I saw that fancy sports car and I looked under the hood and I want to see the gauges, well, this nutrition tracking system lets you look at your gauges and you can say, wow, I reduced my carbohydrate intake and look, my blood sugar also came down. It's a way to track a person's progress. Do you know that weighing yourself more than 15 times a month is associated with weight loss? Imagine that. You're tracking things, you lose weight. Okay, it's the same thing. If you start tracking carbohydrates, start tracking your weight, start checking your percent body fat, either at the gym or on one of those scales, I almost guarantee you that in the next 6 months, your weight and your body fat will probably come down a little bit. Okay, what I did is I bought a new belt. That's a true story. I bought a new belt. Fancy belt. I've had like the same. Have you guys had like the same guys in the room? Probably. Have you guys had the same belts for like 20 years? Is that right? 20. How many? When was the last time you got a new belt? A long time. What about last time a new belt? Yeah, exactly. Right. So my last belt was. No comment. I was in my teens, I'll put it that way. So I've been wearing the same belt since my teenage years, which were like 2 years ago. Anyway, Botox, just for men. Anyway, so I decided to get a new belt, and I finally got an expensive belt, but I made sure when I bought it that it was too small. Too small? Yeah, too small. Too small? I'm forgetting. No, it was too big. Too big, so it was like hanging. No, too small. I'm forgetting. I bought it one way, and all I know is whatever I did, it made me lose weight. And then I had to go back to the store and they cut an inch off, and I felt good. So that's another way to lose. Whatever way you need to trick yourself to lose weight, like, for example, between the hours of 6 p.m. and 8 p.m., I am not allowed to send any text messages from my phone if I'm in my apartment. The only place I can send a text message from is on the elliptical in the gym in my building. Whatever you got to do. And I weigh myself every couple of days, and I look at my percent body fat on the scale every couple of days. These are little silly tricks to keep people motivated, okay? And this is really where things are going. It's an area of personalized nutrition where a person's genes will be assessed, and then we'll be able to intervene more personalized. Make sense? In the last couple of minutes, I wanted to go over the non-nutritional approaches because these work just as well. Physical exercise, so this shows in a mouse. When a mouse exercises, okay, the amyloid, the bad protein in their brain goes down. Look at that. Okay, mice exercising. I love that. Do you guys see that? So cool. I didn't even, like, someone prepared this slide for me, and then I was hysterically laughing, like one of my lectures. It was funny. Anyway, music, okay? Lifelong musical experience or midlife onward can slow brain decline. So this is me. I actually joined a rock band. We were on TV. Pretty cool. We're called the Regenerates, not the Degenerates. The Regenerates, like regenerating brain cells. That was we're a bunch of neurology dorks, anyway. Stress. Less stress is more. More stress, more atrophy of the brain, more shrinkage of the brain, okay? Take lots of deep breaths. Social interaction, that means, yes, more Facebook friends, bigger brains. Yep, Google it. Isaacson, Facebook friends, bigger brains. It's actually, you can read a news story about it. So keep engaged. And then finally, education. So coming out tonight's been great. Joining adult education classes, learning a new language, a musical instrument. These are key. But I'm going to show you a quick course, a quick video, and then we'll end, which is a free course that all of you guys can take online, so you can play. Oops. Okay. Did you know that Alzheimer's begins in the brain over 20 years before it is first diagnosed by a doctor? That leaves a lot of time for people to make brain healthier choices. If Alzheimer's is diagnosed earlier on, we may be able to provide more effective treatments and prevention strategies. That's why we created Alzheimer's Universe. ALZU.org was created by the Department of Neurology at Weill Cornell Medical College, New York Presbyterian Hospital in New York City. All lessons were written by highly qualified Alzheimer's experts and use real-life case examples of families like yours facing the many challenges of coping with AD. You may be wondering, can this disease really be prevented? By sharing information, we can educate each other and work together to lessen the burden of AD. Available online, day or night, on your computer, cell phone, iPad, or other device. ALZU.org has a variety of resources to help on the journey of Alzheimer's. You can learn about the basics of memory loss, the latest treatments for people with Alzheimer's, as well as cutting-edge strategies on how family members may be able to reduce their risk. On our Ask the Experts page, you can submit questions for our expert team to answer. You can also join Caregivers Corner, where users can learn from each other. Once the entire course is completed, you will receive a certificate of completion, and a donation will be made to advance the future of Alzheimer's research. Sign up for a free user account, www.alzu.org. So after you take the course and you learn some stuff, you're going to get some questions before and after. You can do a variety of activities. You can learn about research studies, especially also about the ketosis study we talked about tonight, as well as a variety of other ones. You can join action groups, and there's the nutrition tracking system, the thing that we talked about. You can get access there. You have to finish the first 2 lessons to have other lessons and other activities unlock. It's kind of like a trick. We want to try to get you in, complete the coursework, and then complete everything. It's kind of like we kind of gamify it a little bit. We have a discussion forum, music activities, stuff like that. Okay. So while we don't yet have a magic bullet for prevention or treatment, I really believe that there is more hope now than ever for Alzheimer's. We've had a lot of failures in clinical research, but now is finally the time where we've laid the groundwork, and now I am absolutely certain that in the next 5, 7, 10, 12 years, somewhere in that time frame, hopefully sooner than later, we will have that new thing, that new blockbuster thing that will really make a dent in this disease. Okay, a cure may be a little bit far away, but even something that makes a big dent is way more closer than further. Trust me on this. So thank you so much. Appreciate it. Sure thing.
So I'm lucky enough that I actually don't require a microphone. I'm going to give you all an opportunity to actually ask some questions of Dr. Isaacson. Well, all I'm going to ask you, Dr. Isaacson, is because we don't have more than one microphone this evening, is if you wouldn't mind, if a question that you ask, if you wouldn't mind repeating it so that the whole audience can hear, and then you can answer it.
Cool.
If you could, we'll go ahead and start with you since you had your hand raised. Go right ahead.
You live in New York. Did you read the article in the New York Times a few months ago about having dinner with Dan Buettner? What he wanted for dinner and all that, because he's the guy with the blue zones.
Gotcha. I did not. It's asking about a news article in the New York Times. I did not read that, so I don't know.
Because the reporter went shopping with him.
Okay.
One of the things that surprised him was he drank coffee. He said coffee, and he explained why he drinks coffee in the morning only.
Right.
It's an interesting article to read.
Great. Cool. Coffee in the morning, 2 thumbs up. Okay.
We're going to start with the next question.
Is prefrontal dementia in the class of Alzheimer's disease?
Okay, so there's different types of dementia. The question is frontal dementia or frontotemporal dementia or prefrontal dementia? Is that Alzheimer's? Is that dementia? That's one of the several types of dementias. Maybe 10%, 15% of dementias, depending on what you read. You can have frontal predominant Alzheimer's, which is confusing, or you can have frontotemporal dementia, which is a different non-Alzheimer's dementia. Frontal dementia, frontotemporal dementia, is more likely to have behavioral issues, kind of more agitation, a little aggression, some funny behaviors, and it's most likely earlier onset, so almost always before the age of 70. But it's a different type of dementia.
How significant are games? Do they have these brain games?
Sure. How significant are brain games? So you can do all the Sudoku you want. You're just going to get better at Sudoku. Okay. You need to do cognitive engagement activities that have a spillover effect. Okay, so learning a new language, learning a musical instrument. There's games online that you can join. If you like them, do them. If they're fun for you, do them. If they hurt your brain and they annoy you, don't do them. Do things that involve socialization. Learning something new is among the best things that you can do. Yeah.
What about bridge?
Question was, what about bridge? I think if you learned how to play bridge, that would be good. I think if it's socialization,
Do you already know how to play?
I would say yes. It's with a group of people, so I think bridge is okay. Yeah.
The gentleman in the back, please.
Are all B vitamins created equal?
Are all B vitamins created equal? You can say the same thing with are all fats created equal, or all carbs created equal, or all B vitamins created equal, or all fish oils. No, none of this stuff is created equal. There's good carbs and bad carbs, good fat, bad fat. Actually, most omega-3s are good, but some are much better for the brain than others. And when it comes to B vitamins are confusing. When it comes to cognitive health, B12, B6, and folic acid have the most evidence. Now, you don't want to have too much B6 because too much B6 can cause something called neuropathy, so keep that dose low. You don't want to only take folic acid or only take B12. Some people would say you should take them both together. Never start any of this stuff unless you talk to your primary care doctor, because certain people with different heart conditions may or may not be allowed to take too much folic acid or other things. B12 is usually well tolerated, but usually I recommend the same combination of B12, folic acid, and B6, as long as their primary care physician says okay. Now, what brand is better? I have no idea. Something we talk about in our conference, and I'd love to get your opinion on this, our nutritionist in the room. I've had patients that take the dissolvable type of B12, the sublingual, and I don't know why, I don't know if it's just random, but I've had about a half a dozen patients that they haven't responded as well to that. I don't understand why. Maybe someone can educate me. But certain brands, I think, just maybe not work, or the sublingual. I don't know. So no, all B vitamins are not created equal. Which brand do I recommend? I have no idea. Not really sure.
Who knows?
No one knows. That's the problem. Yeah.
Any other questions? I have the gentleman right there.
At what stage in diagnosis of AD does Medicare actually kick in?
So the question is about what stage of AD or Alzheimer's disease does Medicare kick in? So Medicare, from my perspective, kicks in at 65, so it's age-based. When it comes to early onset stuff, I think if a person is disabled, then a person can apply for disability, maybe, and then I think maybe can get Medicare disability. Then there's Medicaid disability. So it's not like, for example, my mom has hip replacements and knee replacements, and she needs a lot of help. Medicare doesn't pay for that help that she needs. It just doesn't do it. Alzheimer's disease is another disease where Medicare will pay for some stuff, but they're just not going to pay for most of the typical caregiving things.
40% of Medicare dollars are paid for people under 65.
Wow, 40% of Medicare dollars are spent on people under the age of 65. I did not know that. Wow.
Actually, I got a phone call from a brother that's 80 and needs a knee replacement, and his doctor told him last year, don't worry about it with this care, says we'll be able to do it. Come 1 October, the doctor now says the requirement for Obamacare is affecting Medicare now, and he has a problem getting his knee replaced.
Gotcha. Yep. Confusing stuff.
Anybody else? We have one time for one last question.
No hard questions.
Well, this is the hard one. I'm trying to figure out how to phrase it.
Okay.
It's obvious from your presentation that you have to know a lot about the individual,
Yeah.
and there's a lot of issues to be factored in, and there's no one and no size fits all.
Yeah.
And so, that's all background to the question.
Yeah.
Question is, I'll hypothesize that the average typical family doctor would have a great deal of difficulty dealing with the subject. So where does one go?
Yeah, great question. So due to the complexity of Alzheimer's, both prevention and treatment, I think prevention is more complicated, but treatment is pretty complicated too. And it's hard enough for me, let alone a neurologist, let alone a primary care doctor who's treating like all these other things. Where do you go? Do you go to a primary care doctor? Do you go to a neurologist? Who do you go see? Right now, when it comes to prevention, there's only 3 prevention clinics in the country, and we all do things differently. We're somewhat well aligned with the clinic in Alabama. There's also another clinic in LA that I actually haven't really been in contact with too much. So there are 3 places for Alzheimer's prevention in the country. When it comes to just general Alzheimer's treatment, I would say it's always best to see a specialist. I said specialist. That means neurologist, psychiatrist, geriatric psychiatrist, sometimes getting 2 opinions. Unfortunately, a lot of doctors just have 15 minutes, and the way our system is broken, so they don't have the time to spend with people. So I guess what I recommend is going to bigger places with more help, infrastructure, more doctors, social workers, and possibly getting second opinions. And the other thing is about Alzheimer's, get educated yourself, learn about things, read the books, go online, try to find reputable sources. That's a little bit hard. I wish I had an easy answer for you. The goal of our clinic is to try to put together a roadmap. So we just published the first article about how Alzheimer's prevention clinic runs. It literally came out like 6 days ago. And I think Alzheimer's prevention is better done by primary care doctors. I'm making believe I'm like a cardiologist and an endocrinologist, but I'm a neurologist, because so many of the things I do is primary care. So I hope this will change, and our goal over the next couple of years is to try to, we're actually opening a satellite clinic in Puerto Rico. It's going to be run by an internal medicine doctor. So, yeah. Question? Sure.
You've just stolen the thunder a little bit, because if they come back after the break,
Great.
we can talk a little bit about clinical trials as the means by which to understand Alzheimer's treatment.
I should have said that. Great.
I'm just slipping it in there.
Yeah. So after the break, actually, after the break, this is perfect segue, because doctors are only one part of it, because we don't have all the answers. Doctors don't have the tools that they need. So clinical trials is really among the best possible ways to not just get evaluated and followed, but also potentially get an experimental treatment that may actually really, really, really help.